Almost 50% of the world's population live in urban cities. 100 years ago, only 2 out of 10 people in the world were living in urban areas. By 2050, 7 out of 10 people of the world will be living in an urban area. With the majority of humans living in an urbanized city, such as Oakland, pollution should be no surprise. The more people living in these urbanized cities causes more of a need for resources, more jobs, more production, and more waste.
Air pollution is when the air contains gases, dust, fumes, and odor in harmful amounts. These harmful amounts of pollution damages humans, plants, animals, and other materials. The substances that cause air pollution are called pollutants. Pollutants that go into the atmosphere directly are called primary pollutants. Examples of primary pollutants are carbon monoxide and sulfur dioxide.
Within Oakland, the West Oakland community is affected by the most air pollution, which may be attributed to the fact that it experiences the highest frequency of freeway, trucking, and shipping activity when compared to anywhere else in the city. In this area, 10,000 diesel trucks per day move in and out of the Port of Oakland, in addition to diesel emissions from ships, which consists of 70% of the diesel emissions in all of Oakland. This doesn't even take into consideration the fact that residents must travel, typically by car, beyond their own community in order to obtain fresh food and water, and also the non-vehicular emissions generated by construction sites in and around the area. The following pie chart reveals diesel particulate emissions in West Oakland during 2008 and its leading causes. According to statistical data gathered thus far in 2012, Oakland's Air Quality Index, which is a measure of the condition of air quality relative to human needs or purposes, is 13.1% lower than the California average and 13.5% greater than the national average, which places the city at a level of moderate air pollution hazard. Conversely, the Bay Area is no longer among the 25 most polluted regions in the nation as of this year. Nearly 82% of West Oakland residents live within an eighth of a mile of an industrial area, and over 10% of sensitive sites, where there are schools and hospitals, are within an eighth of a mile of a high hazardous facility. In the rest of Oakland, only 2% of sensitive sites face this level of risk. The vast majority of West Oakland residents live in close proximity to at least one of the 403 contaminated or potentially contaminated sites in the neighborhood, which is significantly higher than resident toxic exposure in the rest of Oakland. In 1998, West Oakland generated 5 times more toxic chemicals per capita than the city of Oakland as a whole. It is due to environmental hazards such as this that we see the onset of many debilitating health conditions. In 1998, research has shown that children in West Oakland were 7 times more likely to be hospitalized for asthma than the average child in the state of California. And currently, about 1 in 5 middle and high school students within the Oakland Unified School District have the disease. This means that 20% of the children in West Oakland have asthma, and 40% of these cases are attributed to residential exposures. A total of 37% of the adults in West Oakland have asthma as well, making the disease an epidemic within the West Oakland community.
I sat down and had an interview with Daddy C. Brown. He grew up in West Oakland and he has asthma. So how long have you been living in Oakland?
Been living in Oakland my whole life. I lived on Athens up until I was about 11 years old. Then I ended up moving to the Bottoms down on 8th and Henry up until maybe 19.
So how long have you had asthma?
I've had asthma just long enough to understand it.
So you've had it your whole life?
Yes.
So what were the symptoms of your asthma?
Hard time breathing, wheezing at night, continuously going to the hospital to get breathing treatments. I used to have a lot of mucus, whatever, congestion come up, coughing it up. Well, that's about it. Those are the only symptoms.
Did you have any medication you had to take?
I took Albuterol, which is inhalant, Asthma Port, which is inhalant, I took prednisone, which is a steroid, to open up my lungs once I've had a breathing treatment, which I also received.
How often did you have to take those type of medications?
Every couple of months, as my asthma would get worse every couple of months, then it'd go back down, and then every couple of months it'd go back to a worse stage, and I would have to get a breathing treatment.
And how do you think asthma overall affected your life?
Overall, it didn't affect my life. I had a couple moments in my life where, maybe it was hard for me to really go the full length of exercising or like running or playing, because if I would maximize myself as far as in that type of way of playing or having any type of physical, interaction with outside world, I would have breathing problems in my lungs.
What about cigarettes? Do you smoke cigarettes?
Yes, I do.
How long have you been smoking cigarettes?
Since I was about 14.
Did you notice an increase in your asthma attacks?
No.
No?
No, not at all.
Okay.
I think my asthma kind of adapted to, the cigarettes my system grew immune to cigarettes. So as I grew up smoking cigarettes, it didn't affect my asthma. I think maybe when I first started off smoking cigarettes, it may have, but later on down the line, it hasn't played any effect on my breathing.
Living in the city of Oakland for John as a child was hard. With continuous trips to the hospital to receive treatment, I'm sure it put a burden on his entire family. As a child, John was subjected to live in an area where the air quality was not as up to par as some other areas. Even though his asthma as an adult has gotten better, that might not be the case for the next innocent victim.
Some solutions we could do to prevent further increase of diesel emissions in Oakland is to drive less and instead walk, use public transportation, or even ride our bikes. Even carpooling with friends or coworkers. Lowering that 5% emission of cars can make a big difference. Also, we should make companies that are using truck transportation, ports, and rail yards to pay for the damages that they are causing. For example, paying for the medical treatments of the people living in the polluted affected areas.
Air pollution is only one of the world's problems, but it goes way deeper than that. Each one of us are responsible for his or her own actions and should help take care of the world before there is nothing left.